presented. The chair calls Suzanne Tierney, President and CEO of the Lupus Foundation of America, Greater Ohio Chapter. Welcome, Suzanne.
Good morning, Madam Chair, colleagues, and Finance, Health Committee, and Human Services. Thank you for letting me allowed to speak with you this morning. Good morning to you. I may stumble a little bit. I am a stroke survivor, and I do have some cognitive issues, but we'll get through this best I can, okay? My name is Suzanne Tierney. I am the President and CEO of the Lupus Foundation of America, Greater Ohio Chapter. The Lupus Foundation of America is the national health organization leading the way, devoted to solving the mystery of lupus. It is one of the most cruelest, unpredictable diseases there are. The mystery is unpredictable, it's devastating. While caring and providing support to those who suffer from this brutal impact, our mission is to improve the quality of life for all people affected by lupus through programs of research, education, advocacy, and support. For those of you unfamiliar with the disease, a short version, because I only have a few seconds, I can go on and on with this. Let me give you a brief overview. It is a chronic autoimmune disease. It can affect virtually any organ in your body. It can affect everyone differently. It can affect the skin, the joints, major organs. In lupus, it can destroy healthy tissues. Lupus can be mild, it can be severe, and it can be life-threatening, and many people do die from lupus. The causes of lupus remain unknown. We have limited treatment. We don't have a cure. It is a leading cause of death in women on average, and it takes 6 years to diagnose with an average of $28,000 to treat it every year. Each person has a different story, and since it can affect everyone differently, it is very difficult to diagnose, which is another issue. I stand before you, and although I look perfectly normal and healthy to you, as the CEO, I am also a patient. My journey with lupus began when I was 9 years old. I have been misdiagnosed for over 19 years and treated for various other diseases that has caused other issues along my journey. Most of my life, I sat on the sidelines, lost school, did not have a normal childhood, and I have an identical twin. We're 100% DNA matched, and she's healthy, which adds to the mystery of the disease. Finally, when I had my first child is when the diagnosis was made at the Cleveland Clinic, and I was relieved to actually be told that I had something and we were going to try to fight it. For 43 years, I've been challenged with this disease and doing the best I can. Currently, it has been a journey, a magnitude of different physicians, rheumatologists, psychologists, you name it, we had it. I'm on 23 meds a day, and I'm very passionate about what we do at the foundation. For lupus, living with it was a lonely, miserable, misunderstood disease, and today it doesn't have to be that way. I am a stroke survivor. I do have chronic pain daily. I have several good hours out of the day, and there are peaks and valleys, and lupus does go into remission, and that has been the journey for me. What I have been able to do to have a purposeful life is I use the foundation as a springboard to help others who have been on this journey, so they're not alone and that they have a better quality, a better chance, and give them hope to live with this disease. It's been a privilege to be the voice for over 60,000 people in the state of Ohio whom we believe has lupus, along helping them with their families have a better understanding of this disease. I have sat at hundreds of bedsides. I have been to way too many funerals of young women, mostly African American. This has got to stop. We lean on the national organization to find the causes, the cures, and better treatments, but here at the chapter level, we are the boots on the ground. It has only been recently that we've made great strides in the fight against lupus, especially here in the state of Ohio. We were able to, in 2016, we came to you and asked for funding for the first ever done statewide lupus needs assessment. It was done here in Ohio. Still to this day, the only state that has done that. With those funds, it made a footprint for us to find out what we can do at a chapter level to make changes, and we follow that roadmap. And we are coming to you today to continue asking for funding and to build off of that. And we're asking for the Senate to include $500,000 biannually to the education, awareness, and prevention, and to continue doing the great work that came out of the lupus needs assessment. We do have this roadmap. It was an investment that you made. I can assure you it was money very well spent. I got to go now, I guess, right?
Thank you. I'm so sorry.
That's okay. Thank you
Please
for your
understand,
time.
everyone, that
Sure.
we're keeping each of you to 5 minutes so that everyone gets heard, because we don't want to leave everybody out, and there are so many testimonies from here on out. But we want to get you all in and heard. Thank you. Oh, ma'am, Suzanne, we may have questions here.
Sure.
We have questions.
Hi.
Rep. Schmidt has a question.
Thank you so much for your testimony. First off, I have a twin, but we're not identical.
Oh.
But we look identical, and it shocked me that as an identical twin, you could get lupus, but your twin couldn't, which suggests that there's got to be a nurture component instead of nature component as to why you got it instead of your twin sister. That baffled me, but more importantly is the fact that I have a friend that's 48 years of age, and she not only has lupus and Crohn's, but now she's been diagnosed with leukemia. And I was basically, the twofold question is, in your studies, did they ever determine why identical twins, where the seed splits and two people are formed, you got the unlucky part of the seed and she got the luckier part of the seed? And also, is there a connection also with lupus to getting Crohn's and now leukemia?
Okay. So to the first question with the twin, of course, I pursued this a lot.
I'm sure you did.
And many of the medical professionals will say, okay, does the twin really not have it, or is it dormant and it never came to life? Or is it their environmental trigger that this twin came in contact with when her immune system was low? So the answer, I don't know.
Okay.
I would enjoy more studies on this, of course, and I've been to the Department of Defense to ask them to pursue this because they have funding for this type of research, but it's still unknown. Dr. Hess here in the University of Cincinnati, who's gone now, did some research on it, and she just told me to sit tight. We're going to find the answer, but they don't have the answer. Is it genetic? We are our genes. Much more work needs to be done on that. But I can tell you with lupus, you just don't get lupus. And I'm sure down the road, I probably won't be here for this part, but I think they're going to look at lupus as a spectrum of diseases because you just don't have lupus. Because your immune system is involved, I have several different autoimmune diseases, but I don't walk around with them on my forehead. No one would come near me. Okay, but it's not unusual to have multiple other diseases with lupus.
Thank you. I appreciate it. Just that I would hope that you would go for the study because you are unique in that you can have a more definitive diagnose. You'd have a more definitive reason for the disease if you can prove that it is nature or it is environment, and you're the one that's the unique person to tell that tale.
I'm in a couple of studies currently with my twin.
Thank you.
Yeah.
I don't have any more questions.
Rep. Hoops has a question.
Real quick, thank you, Madam Chairman, and great to see you again.
My pleasure.
You had mentioned in your testimony you were misdiagnosed for 19 years, and this money is going to be used to educate, to let people know. How would your life have been different if they would have known right away, where it wasn't a misdiagnosis?
Well, I believe there has been damage done along the way, and lupus is a disease that goes in remission, comes out. My family took me to Florida every winter. We would go to Florida so I could be in the sun, and I was on penicillin every day of my life until I was 20. Okay, that in effect is a serious issue for lupus patients because lupus patients, the sun is your enemy. I would have hideous rashes and oral ulcers, and while I was in Florida, I would get worse. And then they would bring me back home in the summertime here, and I'm back in the sun again. So it was incredible. Actually, I'm one of God's miracles that I'm still here doing his work as far as I'm concerned. because I did have so many issues. I did share with you that I am a stroke survivor. I did spend some time in a nursing home, and it has been a challenge. And I live with pain every day, but I was privileged to have good insurance. I had a pain clinic, different types of holistic as well as traditional medicine to help me on my way. And I had the best care. It doesn't work that way for everyone.
So, but Madam Chair, but this money will be used to
This money,
keep this so people know what to do.
Right, so we're
Okay,
going
all right.
to, in order for there to be no lupus, you must know it. And most of the problem we have, as I shared with many of you, except for maybe one, didn't know what lupus was. Okay, so we have a lot of work to do, and we also want to train professionals, health professionals, to be on the lookout for an earlier diagnosis.
Thank you. I have a couple of questions. Why does lupus take so long to diagnose? Do we know?
Because there isn't a specific diagnostic test used currently by the physicians, number one. Number two is there's not a lot of physicians who have a thorough understanding of lupus, and especially lupus nephritis. By the time they get to the nephrologist, damage has been done, and it mimics so many other diseases. I was diagnosed as having rheumatic fever, there was a host of different things, liver problems. Because so many organs are involved, it could be a host of different things. So they're doing a process of elimination.
Okay, and my other question is, I suppose that's also why there are so few treatments, because they just haven't pinpointed it. But are we seeing more treatments on
We
the
are.
horizon?
So during COVID, and we don't know how this happened. I mean, I do know how it happened. We have a very long, big advocacy arm amongst our constituents. We were able to go to the powers that be and said, look, we need to get these meds through. So during COVID, we were able to get 2 more meds through the FDA, first time ever for lupus nephritis, which is a huge impact on lupus patients. And the other drug we had was a drug that we used for decades that treated malaria. It's called Plaquenil. And then Benlysta came along, and we were fortunate with that, but not everyone was a candidate. It's infusion, and it's very, very costly. Even next month, we will go to the nation's capital and ask for more funds for NIH, CDC, and for DOD.
Okay, thank you, Ms. Tierney. Thank you. The chair calls Adrienne Fernandez, Lead Project Coordinator for the Lupus Foundation of America, Greater Ohio Chapter. Welcome.
Thank you. Good morning, Chairperson Carruthers, Ranking Member Liston, Representative Hoops, Representative McNally, and Representative Schmidt. It's an honor to appear before you today at this important hearing. My name is Adrienne Fernandez, and for the past 10 years, I've actually worked for the Lupus Foundation of America, Greater Ohio Chapter. I'll try not to get into too much detail. Suzanne covered a lot, but we are an affiliated chapter of the Lupus Foundation of America, which was founded in 1977 as a national voluntary health organization based in Washington, D.C. The network of chapters and regional offices are located in communities across the United States, and the foundation is devoted to solving the mystery of lupus. I stand before you here today, as many of you know, since we've spoken with you, not only as an employee, but also as a patient. I found my way to the foundation, and they helped me so much, I decided to join the staff. I'm not going to get into too much about what lupus is. I think Suzanne covered that. I'd like to provide some key facts. The cause of lupus remains unknown, and there is also no cure. Lupus is among the leading causes of death in young women if you exclude accidents. Lupus is chronic, meaning if you have lupus, you will always have lupus. On average, it takes 6 years. I know Suzanne mentioned that to get diagnosed. It's estimated that 60,000 Ohioans and 1.5 million Americans have lupus. 9 out of 10 persons with lupus are women, though men and children and teenagers can get the disease as well. 1 in 3 lupus patients has been temporarily disabled by the disease, and 1 in 4 receive their health care through a government-sponsored program such as Medicare or Medicaid. Lupus is 2 to 3 times more prevalent among minorities. In addition, 50,000 is lost annually by each lupus patient in healthcare costs and lost productivity. Before 2021, as Suzanne mentioned, only 1 medication had been developed specifically to treat lupus, and in the past few years, we've seen 3 new medications come to light, so that's been wonderful. In 2016, As mentioned, this in the state of Ohio, through the Ohio Lupus Needs Assessment was done through the Ohio Department of Health to determine basically, what care services we needed to better coordinate to promote better health outcomes for persons living with lupus in the state of Ohio. The assessment basically revealed that a lot of work needed to be done, and we were given funding to basically roll out those revelations that were revealed and the recommendations revealed by the Lupus Needs Assessment. We've done a lot with that. As Representative Hoops mentioned, letting people know what lupus is, helping to not only train physicians in terms of what lupus is, maybe those that aren't specialists in rheumatology, but those who might be in more generalized fields need to understand what lupus is. So that was part of it. We've had a major marketing campaign that allows people to learn about lupus, especially the minority community, where they may be having symptoms but don't really recognize that a disease process might be ongoing. We have had over 2,000 lupus patients attend our statewide lupus summits. We've created a podcast, a blog. We're really just getting the information out there, a magazine. We have a minority-specific PSA campaign. We've hosted a Lupus Disparities Education Summit. We have one upcoming in Minority Health Month around the corner. And most importantly, we've implemented a statewide patient navigation program, and that's been incredibly important to the patients. These are individuals across the state of Ohio in the field working with patients one-on-one to help them successfully navigate their disease. As Suzanne mentioned, we're excellent stewards of the state's funding, and we're very dedicated to our mission. So you can rest assured that we're doing what needs to be done. As mentioned in our meetings, we appreciate Governor Dewine, the Ohio Department of Health, and the Ohio House of Representatives for including the Lupus Foundation of America Greater Ohio chapter in their budget for lupus education and awareness in the amount of $420,000. Due to the pandemic and increases in food insecurity, we've noticed a marked increase in requests for food assistance from lupus patients, and we'd like to provide health agencies across the state with further lupus continuing education. So we are asking for a 19.04 percentage increase to $500,000 over the biennium. We believe the funding is critical to reducing the burden of lupus in the state of Ohio. We know you have many requests for funding, and all of them are important, and we really appreciate you for taking the time to learn about lupus, meeting with us, and speaking with us. Thank you.
Thank you. Questions? Hearing none, thank you so much.
Thank you.